I'd like to
Okay.
introduce Ali from England, and Ali has ME. Welcome, Ali.
Hi there. Hello.
Could you tell us when you first started getting your symptoms?
Yes. In my early 20s, I had a lot of tonsillitis and a lot of colds and flu. Then I had them removed, and I was well for a year. And then I moved to London, and I started to get really tired for no apparent reason. And I just picked up everything going. Then I had glandular fever, and lots of jabs to go on holiday, lots of vaccinations, anti-malaria tablets, and antibiotics for an abscess on my tooth. And that was it. I came back from holiday, and everyone said to me, "You don't seem like you're very well." And I didn't feel well at all, but went through the motions, kept going into work. And then finally, one morning I woke up and I couldn't walk. My legs were too painful for me to move. So I called downstairs and phoned in work, and that was it really. And I kept trying to go back in, and they would just send me home because I looked so dreadful. And that was that was 1999.
Yes.
I finally got a diagnosis in 2000.
Right. And what were you offered from your own GP?
Well, my own GPs were saying I was depressed, and I was saying, yes, I am depressed because I've gained loads of weight, I'm tired and I'm in pain. But, you know, that's why I was down. I didn't think that the problem was depression. But the consultant at the ME centre just offered me antidepressants, and that was about it really, nothing else. He wanted me to go in and spend several £1,000s on some rehabilitation, and I'd looked into it, and I'd seen that, you know, there wasn't really a treatment protocol at all. It was just a case of pacing, which means having regular breaks, and graded exercise, which is doing a little bit more each day. And I thought, well, I can do that for myself. I don't need to sort of pay to do it. So they were the only options.
So when did you find LDN?
I went to hospital in 2001. They thought I had Cushing's, and I didn't. I had polycystic ovaries, and I was insulin resistant. So that made me change my diet, and I cut out lots of refined food. I lost a lot of weight and got quite a lot better with a lot of Pilates and yoga. And I was quite well for a few years. I went back into work, and then I lost my job again, got made redundant, followed with a massive cold that lasted a year and a half, and down I went again. So I went, because I hadn't done any research for a couple of years, because I kind of had the ME under control, although it wasn't cured at all.
Yes.
I knew that you know, there were probably somebody might have made some headway with some treatment or something. So I went frantically searching on the internet to find that there wasn't anything still. But I did come across LDN, and I printed off lots of information. I went into my doctor, and luckily for me, he has a special interest in ME. So he was very open to me trying LDN. So that's what I did.
And what did you find LDN did for you?
When I first took it, this was December 2009. It was coming up to Christmas, and I was really desperate to try it because I really thought it would be great if I have some energy over Christmas. It would be normal. But when I first started it, I was quite jittery, and I was one of the people that couldn't sleep very well. So I changed to daytime dosing, and then after a month or so, went back onto nighttime dosing, and I've been absolutely fine. It's been wonderful for my fatigue. My usual routine would be to get up about 8:30, 9 o'clock, and by 2 o'clock in the afternoon, after lunch, I would just need to rest and probably sleep. I'd sleep for maybe 2 hours. So that was my routine. But slowly and surely, and I hadn't even realised I wasn't sleeping anymore, I didn't need to. So it's the horrible fatigue that you get with ME seems to have vanished. I mean, if I overdo it, then I still pay for things, and I'm tired, but the actual fatigue element has all but gone, really. I am still tired, but not fatigued, which is one of the most nastiest symptoms for me. because you can't really do anything. You can't go out for the day or
No.
work or with that because you can't. You have to sleep.
So what about pain levels? Have they improved?
Yes, I used to get. I used to call it I've overdone it pain. If I did too much, then I would get pain, shooting pains in the top of my hips, and that was my signal that I needed to go and rest. But suddenly, before I started taking the LDN, I used to get it quite a lot, and I used to get it on waking in the morning. So I'd wake up stiff and in pain, and almost immediately I took the LDN. That all stopped as well. So the pain in my hips really, I don't hardly get it only if I do too much. So that's made a big difference.
Did you have any?
Also,
Sorry.
I was going to say my immune system has really picked up because I used to always have a cold. If I was near anyone who had a cold or a virus or anything, I'd pick it up. I had months, years before last, even though I've had it as a child. You know, I really would just get anything and everything. But I don't anymore, and I'm studying, and I sit next to people in class who are coughing, and, you know, I don't get it. So it's really, really helped my immunity.
Did you have any initial side effects when you first started?
The only side effect that I suffered was not being able to get to sleep. Even with sleeping tablets, I still suffered, and I had done a bit of research, and I know it says to take the LDN at night because that's when the endorphin effect happens. But I'd also read that it's okay to do daytime dosing, and I did the daytime dosing for a while, and it still worked. I still, you know, wasn't sleeping in the day, and the pain was still better. So I thought, well, it still must be working. And then after a few months, I thought I'll try and switch. So I switched back, and I got a really good night's sleep. Well, that's the other thing. I don't wake up through the night anymore. So I used to wake up 3 or 4 times through the night. You get kind of broken sleep with ME. But I don't do that anymore. I sleep from when I shut my eyes to when I'm open. They're open again in the morning, and I have to get up, which is fantastic.
A lot of people with ME seem to be very sensitive to drugs. Did you have to have a very slow introduction?
I didn't start really small, and because I'm getting, I know a lot of people have to get 50 milligram tablets and put them into water, and then take, you know, use a syringe to take the LDN. I was actually getting mine prepared, especially from the pharmacist. We started on 3 milligrams. And looking back, I did have sort of, my symptoms did come to the sort of top first. I did feel quite dreadful for the first few weeks, but that soon subsided. I stuck with it. So thinking about it, I probably could have started on a smaller dose, but I do have friends that are on sort of 0.1 of a milligram, and they're feeling great on it. So I think with ME, you are extra sensitive. So if I would say to somebody, if they are trying it, to probably start really small, like I didn't. But I'm on 4.5 milligrams now.
So what would you say to other people with ME on top of that who are rather scared of taking LDN?
I would say really give it a go. You really don't know until you've tried it, and it has just been wonderful. It's really nice not to have to sleep, you know, lose half a day through sleeping. It's really nice not to have to go down with a cold every few weeks, especially in the cold season. And it's nice to have a little bit of energy. It's just been such a fantastic drug. It's such a cheap drug. And I think if you can take enough information to your GP and, you know, try and persuade him to let you try it, I think it's well worth it.
Well, thank you very much. Sorry.
Sorry, you know, say stick with it. It can be a bit bumpy at first, but really stick with it, and you'll see the results.